This is Yannick Riding with Empire Surgical, and today I'm going to walk you through a left shoulder anterior Bankart repair using a single loaded 2.9mm Lupine anchor. There are two different types of tears in your labrum. You can have a slab tear, which is a superior labrum tear, anterior to posterior, or a Bankart tear, an anterior or inferior tear of the labrum. Now, what usually causes a Bankart tear? It's usually dislocation of the shoulder joint. So what's happening is your humeral head pops out of your glenoid, causing a tear of your labrum. Symptoms for a Bankart tear are usually, general instability of the shoulder joint, repeated dislocation, and just general achiness and pain in your shoulder. So the first thing we're going to do is we're going to set our portals. We have our posterior portal, which will be our viewing portal. It's set at 2 centimeters inferior and 2 centimeters medially of the acromion. Then we have two interior portals. We have a superior and an inferior anterior portal. So first thing we're going to do is we're going to go into our joint space, to glenohumeral joint space through our inferior portal. And we're going to use our vapor and shave off any of the frayed labrum and use our probe to identify our tear. So once we've identified our tear, we're going to go in with our tissue liberator and free up any of the tissue that might have incorrectly healed to the glenoid. Last thing we're going to do for the preparation for our repair is use a rasp to create a bloody bed on the glenoid to promote healing. So moving on to the anchor placement. For the Lupine anchor, we have 4 different types of drill guides to choose from. We have a hybrid, sawtooth, dovetail, or fish mouth. So it's surgeon's preference, whichever drill guide he prefers. Then we place our drill guide on our glenoid rim, going in through our inferior anterior portal. Place it right on the glenoid rim and remove the obturator and drill until it bottoms out. Once it bottoms out, we'll remove our drill guide, place our anchor, and mallet the anchor in until it bottoms out also. Then we're going to unwrap our suture and unscrew the handle to remove our inserter. So to pass our suture, we have 7 different options with our ideal suture shuttle. We got a crescent, a straight hook, 25-degree left and right, a 45-degree left and right, as well as a 90-degree up. So for left shoulder anterior Bankart tear, we're going to use our 45-degree left because we got to go behind the labrum through the glenoid. So first thing we're going to do is we're going to go in through our inferior portal, and we're going to go through the back of our labrum and push the chia through the tip of our suture shuttle, ideal. And we're going to pull it through the back of the labrum, coming out. We're going to pull it out of our superior portal. Once it's out of our superior portal, we're going to use the crab claw, go back into a joint space and grab one limb of suture and put it out of our superior portal. Then we're going to attach that limb of suture with the chia, going back through the labrum, retracting that limb of suture through the labrum, so we have one limb of suture on each side of the labrum, and that limb of suture is also known as our post. So once we have then both limbs of suture coming back out of our inferior portal, we're going to do a sliding knot, sliding knot with several other hitches to slide our knot down on top of the glenoid rim, putting our labrum back in, restore it into our natural anatomical position. Now what we want to make sure when we're sliding down the knot, we want to make sure that the knot does not sit on top of the glenoid, because we don't want it to interfere with the natural articulation of the humeral head with the glenoid. So we want to make sure that the limbs of suture are in the back of the labrum. So last thing we're going to do is go in and check the integrity of the repair, and once we're satisfied, we're done with our left shoulder anterior Bankart repair. This was Yannick Riding with Empire Surgical. I hope you enjoyed watching my video. Any feedback is appreciated. Have a great weekend.